She is one who has delivered one viable child. Parity is not increased, even if the fetuses are many twins platelets primipara. Newborn baby automatically turn the face towards the stimulus and make sucking. This reflex is known as rooting reflex. A woman had a midline episiotomy performed at delivery. The primary purpose of the episiotomy is to enlarge the vaginal opening. The ideal pelvis for childbearing is pelvis, gynecoid pelvis. If gynecoid pelvis brim shape is round, how we can estimate EDD? EDD means expected date of delivery. First day of last LMC, last menstrual cycle, plus 280 days. First day of LMP plus 9 months plus 7 days is right for estimate EDD. Bimastoid diameter is 7.5 cm. As per the guideline of American Cancer Society for women aged 45 to 54 years, a mammography is recommended once a year. Lochia rubra is in color red. Placenta previa. Placenta previa, in which placenta reaches the margin of internal os and not covering it, is known as marginal placenta previa. The first evidence of pubertal development in female is usually manifest as appearance of breast buds. What you mean by second stage of labor? Full dilatation of cervix to expulsion of fetus. The most important observation for a patient in labor in pitocin augmentation is monitoring and recording the length of contraction. At 12th week of gestation, amniotic fluid measures about 50 ml. The drug of choice for treatment of cholera during pregnancy, furazolidine. Azoospermia means absence of motile and hence viable absence of motile sperm in the semen. The drugs of choice in eclampsia is magnesium sulfate. Endometriosis is tissue that normally lines the uterus grows outside the uterus. Drug of choice to enhance the third stage of labor is ergometrin. Kegel exercises are useful in strengthening of the pelvic muscles. In which of the following conditions would it be indicated to deliver the baby by forceps? Heart disease. After the birth of the baby, foramen ovale closes and it becomes fossa ovalis. Which among the following intervention will be helpful in preventing thrombophlebitis following delivery? Early frequent ambulation. Degree of uterine systole is measured in terms of intensity. Gestational trophoblastic disease is GTD is vesicular mold. Yellow colored amniotic fluid indicate hemolytic disease of the newborn. Duration of latent phase in multipara is about 4 hours. The realignment of fetal head with the body after the head comes out during the process of delivery is known as restitution. All are tocolytic agents except tocolytic agents indomethacin, magnesium sulfate, nitric oxide donors, but except diazepam. Placenta previa, in which placenta partially covered the internal os, is known as incomplete placenta previa. Commonest cause of bleeding at term as abruptio placentae. The single most important investigation in cases of menorrhagia is papal sampling. Site of fertilization in female reproductive system is fallopian tube. Station O is indicative of the presenting part being at the level of ischial spine. In placenta previa, vaginal examinations should not be done to avoid hemorrhage. Conjoined twins united in or near the thoracic region is termed as thoracophagus. Teratogenic effect of unprescribed drug affect the fetus, most commonly in first trimester. Abortion is the termination of pregnancy before 24th weeks of pregnancy. The steroid used in preterm labor helps in reducing respiratory distress syndrome, reducing RDS. Identify correct statement regarding gynecological salpingitis. The symptoms usually appears following menstruation. It is usually bilateral infection. It is a sexually transmitted disease. Neuromuscular harmony is described in terms of polarity. The indication of forceps delivery is the delay in second stage of labor due to poor maternal efforts. The most frequent cause of maternal death during childbirth, hemorrhage. The risk factor for the development of thromboembolic phenomenon in a woman with cardiac disease will be The intake of steroidal contraceptives. Clinical feature of heretiform mole is snowstorm appearance in ultrasonography, absence of fetal parts and fetal heart sound, elevated levels of HCG, human chronic gonadotropic hormone. It refers to the relationship of the long axis of the fetus to the long axis of the centralized uterus or maternal spine lie. Commonest begin solid tumor in female is fibroid uterus. What is the cause of primary cervical dystocia? Post-birth in which external os fail to dilate, rigid cervix, insufficient uterine contraction. All of the above answer. Epimenorrhea is known as polymenorrhea. A procedure that allows the physician to examine the lining of the bladder is called as cystoscopy. Which of the following is not one of the causes of intrauterine growth retardation? Gestational diabetes. Fusion of sperm and ovum is called fertilization. The amount of fetal blood flow per minute through the placenta is 500 ml. The structure that supplies nutrition to the growing ovum before placenta takes the function is corpus luteum. Which among the following parameters need to monitor by the nurse following delivery in a woman with stable vital signs? Determine characteristics of lochia. Short cord is then if the length of the umbilical cord is less than 20 cm. When the changes of acute endometritis developing in a woman after abortion or childbirth. The first sign seen in pregnancy is amenorrhea. The contraceptive method advised in clients with molar pregnancy is oral contraceptives (OCP). Best method of contraception in a nulliparous woman is combined oral pills. Placenta previa, in which placenta completely cover the internal os, is known as central. Communication between umbilical vein and inferior vena cava in fetal circulation is known as ductus venosus. Ductus venosus. Definitive treatment for grade 3 placenta previa is caesarean section. Most commonest cause for rupture uterus is obstructed labor. The lower uterine segment is formed from the isthmus and cervix. Adverse effect on female sexual functioning in postpartum is prenatal lacerations, milk ejection with stimulation, fatigue, and exhaustion. Hypoglycemia in a baby of diabetic mother is because of increased insulin. The maximum amount of blood loss the maximum amount of blood lost during delivery is 500 ml. The brim of the anthropoid pelvis is oval shaped. Fetus forms from inner cell mass. Universal attitude is flexion. Cervical cancer staging is primarily based upon clinical examination. The commonest cause of primary dysfunction liver is primigravida is inadequate uterine contraction. The safest position for a lady with cord prolapse in liver is Tendal, Tendelberg positions. Greenish yellow color amniotic fluid indicate post maturity of fetus. The degree of uterine prolapse in which the uterine body descends to lie outside the introitus is third degree uterine prolapse. The expected date of delivery for a lady whose LMP was August 15th is May 22. Calculate by the formula of EDD expected date of delivery calculation formula 9 month plus 7 expected date of delivery LMP plus 9 months plus 7 days expected date of delivery equal to LMP last menstrual period plus 9 months plus 7 days. It is the formula of calculation of expected date of delivery for the lady who is pregnant. The most significant constituent of human breast milk by weight is water. The diameter extends from the nape of the neck to the center of bregma is called as suboccipito-bregmatic. Clinical features of abruptio placenta is all of the above: dark colored bleeding, revealed, concealed or mixed tape, fetal heart sound usually absent. Complications of oxytocin include uterine rupture, water intoxication, uterine hyperstimulation. Correct order of spermatogenesis: germ cells, spermatogonia, primary spermatocyte, secondary spermatocyte, spermatids. The optimum time to insert intrauterine device is immediately after menstruation. The most common cause of postpartum hemorrhage PPH, uterine atonicity. Which of the following is the most important predisposing factor of abruption placenta, hypertension in pregnancy, type of placenta previa in which the placenta partially covers the os is type 3rd, Klumpicles paralysis is a result of damage to the lower branchial plexus of 7th and 8th cervical nerve. Oxygenated blood from placenta goes to fetal heart ductus venosus. Mechanism behind placental separation is reduction in surface area at the placenta site. In preterm babies, to avoid retrolental fibroplasia, oxygen concentration should not be more than 60%. Soft spot in the skull in between the sutures is known as fontanelle. Contraindication for use of ergometrine methargine include suspected pleural pregnancy, organic cardiac disease, Rh negative mother, all of the above answer. Bed rest is essential in preeclampsia since it improves blood circulation and decreases edema. Contraction stress uh, contraction stress test CST is also known as oxytocin challenge test. The realignment of fetal head with the body after the head comes out, restitution. Ovulation day of a woman who has 28 days regular cycle with menstrual day of January 31. Answer is January 17. Hormonal influence of menstrual cycle include hypothalamic releasing hormone, pituitary hormones, ovarian hormones, all of the above answer. Which of the following drug is administered to control eclamptic fits? Magnesium sulfate. System, systematic symmetric bluish discoloration of the extremities in a newborn is called as acrocyanosis. Aspermia is failure to produce semen or absence of sperm from the semen.